And then the next thing is obviously looking at the timing for surgery. So for any of the physios here, I'd love to know what you guys think of your times, or when basically the optimal time for surgery is. But from all the research that I've been reading and stuff, and all the research that I know, and all my patients that sort of come in with these kind of sort of injuries, the first 2 weeks to the first 6 weeks is where I would love for that tendon, this is the person's tendon, to be repaired. What is your optimal time, Dimitris?
Totally agree with you, Ross. The ideal time frame is within the first 2 weeks. If that is the case, most likely you can use a 2 centimeter incision over the forearm, deliver the tendon, and repair it safely. If beyond the 6 weeks period, then most likely you have to do 2 incisions, still two centimeter incisions, nothing significant. We will see later on the video from one of my colleagues who confided in me to do his biceps repair, which was around 6 weeks, post-injury, with good outcomes. But the patient needs to understand that there is a higher chance of a higher degree of potential complications from it. And if you extend beyond 6 weeks, there are cases where the retraction is significant, where you might need to use an allograft. Most commonly an Achilles tendon allograft or a palmaris longus allograft. So either an allograft taken from the forearm of the patient, or either an autograft from the forearm of the patient, or an allograft from an Achilles tendon to augment your repair. Why? Because you cannot deliver, it's so scarred up that you cannot deliver the tendon all the way down and fix it. So you need to augment your repair. And that delays the rehabilitation, obviously, and that has more potential chances of complications. Yep. What I tend to tell the patients, is that this is a decision that unfortunately they have to make quite soon after they see me, okay? Yep. And that if they are happy to accept that, they will lose some power in supination, significant power, in supination, and some power in flexion, and that they will have cramping in their arm and forearm for at least 6 to 8 months after the injury. If they're happy to accept that and accommodate with their way of living and profession, fine. If not, the sooner you do it, the better it is. Yeah. The safer the outcome, the quicker the recovery.
Absolutely. I think the same thing goes for rehab. So a lot of the guys who I see with their own tendon repair recover so much more faster and so much more better. But again, it all is about sort of that gradual, slow progress. So the job with the surgeon is done, but when it comes to sort of, going into physio, that's a whole nother ball game. And you've got to be really sort of very, very clear when you sort of start this whole journey, because it's not just going to be a surgical connection and then that's it. I'm back to 100% back playing sports and stuff straight away. It's going to take a lot of time. There's going to be lots of hiccups, ups and downs. We may even need to send you back to the surgeon to have it looked at a couple of times, like for reviews, for checkups and things like that.